Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is briefly made clear and often illustrated. Today's topic is about hypothalamus nuclei connection. In the previous video, we have seen the structure of the hypothalamus and its different nuclei. Today, we will see how these nuclei are related with each other and with other organs. Just remember, hypothalamus three main functions: limbic, endocrine, and sympathetic and parasympathetic. Diencephalon include epithalamus, pineal gland, metathalamus, geniculate body, subthalamus, hypothalamus, and posterior pituitary, of course, plus chiasma optic and thalamus. Hypothalamus, 4 grams, influence any tissue from head to toe. Sheet of gray matter around the third ventricle, present in lateral wall of the third ventricle and in the floor of the third ventricle, as tubal cinerum and infundibulum pituitary, posterior mammillary body and midbrain. It extends from optic chiasma to interpendicular fossa. It is a structure with 2 left and right lift of shift. Midbrain, right thalamus, left thalamus. Right hypothalamus, left hypothalamus, third ventricle, mammillary body, and posterior pituitary. We will be interested in first, hypothalamus, second, optic chiasma, third, pituitary, 4, mammillary body, 5, thalamus, 6, hippocampus, and 7, amygdala. This is a mapping to remember nuclei. We start with this core, with the eye of this core. There is 3 nuclei around this eye. The upper one is suprachiasmatic nuclei, concerned with circadian rhythm. The other one is supraoptic nuclei, antidiuretic hormone. The third one is preoptic nuclei, gonadotrophin releasing factor, sex. From the anterior, there is the parasympathetic and anterior anti-rise nuclei to fight against the heat. Anti-rise, think of summertime. Posterior, anti-fall, and sympathetic, think about wintertime. Paraventricular is about oxytocin. Dorsomedial nucleus is about hunger, and thirst. Ventromedial nucleus is about satiety and a good reward. Mammillary is lip stir while eating and recent memory. The last one is arcuate. Arcuate is a growth factor, a growth reason factor, and growth inhibiting factor, TSH releasing factor, corticotropic releasing hormone, and prolactin inhibiting factor. Most of the factors coming for archaeoid, they go to the portal system to go to the anterior pituitary. Remember, arcuate, anterior pituitary. Paraventricular nucleus is posterior pituitary. Paraventricular nucleus is for oxytocin. Arcuate nucleus is for prolactin inhibiting dopamine. Let's see the connection between these nuclei. The first pathway is parasympathetic dorsal longitudinal fasciculus, the red one. Parasympathetic dorsal longitudinal fasciculus, number one. Number two is sympathetic hypothalamic spinal pathway. Number two is sympathetic hypothalamic spinal pathway. Number three, there are three nucleus here. There are the dorsal tegmental nucleus, the ventral tegmental nucleus, and the raphe nucleus. There is a connection from three nucleus to the mammillary body, and this connection between three nucleus and mammillary body is mammillary tegmentum pathway. The reverse pathway from mammillary to three nuclei is mammillary pendicle pathway. Then we move to 5, which is supraoptic and paraventricular to posterior pituitary. Supraoptic and paraventricular to posterior pituitary. And 6, arcuate to anterior pituitary. 6, arcuate to anterior pituitary. 7 is fronto-orbital septal olfactory to medial forebrain bundle. This is the 7. Remember, mammillary is the intersection of all pathways. From hippocampus is fornix. From amygdala, there is 2 pathways, the ventroamygdala fungi and the stria terminalis from amygdala. From mammillary to ventral tegmental nucleus and dorsal tegmental nucleus in raphe, it's mammillary tegmentum. From the 3 nuclei to the mammillary body is mammillary peduncle. From the mammillary to thalamus, there is 2 ways. The first way is the mammillary thalamic tract, and the second way is inferior thalamic peduncle. Thank you for watching this episode of Medicine in 3 minutes. Would you like to put the like button and subscribe? Your comments are very welcome. Thank you.